Welcome to Pharmacology part 16. So here we will discuss, I think previously we were discussing about newer agents, right? Some of the newer agents, newer opioids we will discuss because they can be a potential MCQ in the upcoming Neet PG exam. Some newer opioids are prescribed for Rett syndrome, that is trofinetide, and also for Friedreich's ataxia. For Friedreich's ataxia, you use omaniloxolone, right? Now we will discuss some drugs for smoking and alcohol. Very, very important. It will not be given as a direct question, but it will be given as a clinical question. Remember. Now, what are the drugs for alcohol and smoking dependence? Right, I'll write here dependence. Right. Now, we will start with alcohol. Okay, alcohol which are FDA approved. Remember, these drugs are FDA approved. First, I will talk about the drugs which are FDA approved. The first drug is disulfiram. What is a disulfiram? Disulfiram is a aversive agent. Right? What does the disulfiram do? What it does is it blocks aldehyde dehydrogenase. Right? Aldehyde dehydrogenase. It blocks aldehyde dehydrogenase. Now, what it does is this alcohol, if in the patients of alcohol who are having alcoholism, there is excess deposition of aldehyde, right? There is excess deposition of aldehyde. There is an increase aldehyde. So what do we observe? Some of the side effects of these drugs are palpitations, tremors, sweating, chest pain, feeling of doom. And one more important thing is these disulfiram, before administering this drug, it requires at least 12 hours of abstinence. Remember, that's a sure shot MCQ. It requires at least 12 hours of abstinence before taking disulfiram. Now, if you ask me some more drugs, that is naltrexone. See, naloxone is a IV drug of choice for opioid poisoning. Naltrexone and acamprosate. These two drugs are anti-craving drugs. Now, what are some of the side effects of this drug? It is hepatotoxicity. They cause hepatotoxicity. Now, sometimes these drugs can also lead to depression, suicidal tendencies. Patient may have suicidal tendencies. Okay, we discussed about FDA approved, but if you come to non-FDA approved, there are some drugs but which are non-FDA approved. Some drugs which are non-FDA approved. These are non-FDA approved anti-craving agents. Anti-craving agents. What are those? Benzodiazepines. Clonidine, topiramate, baclofen, then ondansetron. So these are all the drugs which are actually non-FDA approved drugs for alcohol. Now if you come to smoking dependence, what are the drugs for smoking dependence? And some considerations also we will look into. Now first line is bupropion. This is the first line drug, and it also acts as antidepressant. Second one is varenicline, bupropion. These are the first line drugs. What is a varenicline? What is its mechanism of action? It is a partial agonist at alpha 4 beta 2 nicotinic receptor. And trust me, varenicline is the most effective anti-smoking drug. This is one important thing that you should remember. Varenicline is the most effective anti-smoking drug. Now one more first line treatment is there, that is nicotinic replacement. Means gums, nothing but nicotine gums. It is available as nasal spray, and nasal spray is most effective replacement route. They are available as patches, available as gums, available as lozenges, right? But you have to remember one fact here. While taking these gums or lozenges, avoid fluids, right? 15 minutes before and after taking this gums or lozenges. Before or after consuming gums or lozenges, before or after 15 minutes before and 15 minutes after, you avoid liquids. You should not take any liquids, right? Now that is about gums and lozenges. Now we will discuss something about the second line drugs, right? The second line drugs. What are the second line drugs? Clonidine, tricyclic antidepressants, and cysteine. Okay, cysteine. Now previously we discussed about anti-epileptics, but we want to discuss further about anti-epileptics complications. Why? Because the complications of anti-epileptics are always an MCQ appearing in Neet PG. Okay, so we will take the first three most important anti-epileptic drugs. Okay, the first three most important anti-epileptic drugs, that is valproic acid, hydantoin, and we'll discuss another one, that is carbamazepine. Hydantoin means which drug? Can anyone? Phenytoin. Now remember one thing. Each of this has a mnemonic. You just remember those mnemonics. That will be sufficient. And I don't want to go in detail about the mnemonic because it's time consuming. I will just tell that mnemonic. You just listen to the class and you write those mnemonics. Okay. And you write those mnemonics. Now, if you come to valproic acid, the complications are T-valproic is the mnemonic. T for tremors and teratogenic. It has the maximum teratogenicity. Remember, valproic acid causes neural tube defects. Folic acid deficiency causes neural tube defects. So, it has maximum teratogenicity and tremors. And V for vomiting and nausea. A for ammonia increased. There is hyperammonemia. L for liver toxicity. P for pancreatitis. R for rash. I for infertility in females causing PCOS. Infertility in females with PCOS. C for carnitine used as an antidote for liver toxicity. That is C. C is not a complication, but C is defining that if it causes liver toxicity, we can use carnitine as the antidote. Carnitine as the antidote for liver toxicity. And finally, valproic acid, acid A for alopecia. This drug also causes alopecia. That are the side effects of valproic acid. Now coming to hydantoin. Hydantoin is very much important, right? Don't neglect the side effects of anti-epileptics. It is always an MCQ, right? Hydantoin, you take H for hirsutism and hyperplasia of gums. Hyperplasia of gums, I will write here. It is very important statement. Hyperplasia of gums is caused due to phenytoin or hydantoin drug. Hyperplasia of gums. And Y for, Y don't have any other word, but Y actually is lymphadenopathy. D for diplopia and decreased vitamin D, that is hypocalcemia. A for ataxia and agranulocytosis. Hydantoin or phenytoin causes agranulocytosis, remember. And N for nystagmus. T for teratogenic. Hydantoin, phenytoin causes facial cleft, remember. It is of teratogenic drug. Facial clefts. O for osteomalacia and IN hydantoid. IN for increased bleeding in newborns. Increased bleeding in newborns. Why? It causes increased bleeding in newborns. So what we will do, we administer vitamin K to the newborn. That's it. Now if you come to carbamazepine, you have mnemonic heads. H for hyponatremia. Remember, this is one more important statement. Carbamazepine cause hyponatremia. It is the delayed side effect which is most commonly seen in elderly, right? Remember that one also. It's a delayed side effect but most commonly seen in elderly. Okay, clear? Next, E for eosinophilia. E for eosinophilia. A for ataxia and aplastic anemia. Ataxia and aplastic anemia. D for diplopia and S for Stevens-Johnson syndrome. Stevens-Johnson syndrome is caused by carbamazepine. Stevens-Johnson syndrome. You got it? Why? And one more thing is oxcarbamazepine and elicarbamazepine. These are two two other forms of carbamazepine, that is oxcarbamazepine. I will write here oxcarbamazepine and early carbamazepine. These two are less toxic than carbamazepine. They are less toxic, but what they cause? More hyponatremia than carbamazepine. They are less toxic than carbamazepine, but they are more hyponatremia. They cause more hyponatremia than carbamazepine. Now, I just want to say one thing: ataxia and diplopia, which are side effects of hydantoin, can be managed with therapeutic drug monitoring, and also you can do something called dose adjustment. Okay. Now, if you come to lamotrigine, it causes Stevens-Johnson syndrome, which is caused by carbamazepine. So, always start lamotrigine at low dose. As a precaution. Now, if you ask me topiramate, sir, what do topiramate causes? Topiramate causes important thing, renal stones, and also it may cause acute congestive glaucoma, and it causes other side effects like metabolic acidosis, weight loss, right? It also causes weight loss. So this side effect is the reason. See, one of the surprising thing, as weight loss is the side effect of the topiramate, some of the clinicians prescribe topiramate for obesity people. So the side effect is in turn converted to what? As a advantage, as a therapeutic treatment. The side effects get converted into therapeutic treatment. Now we will discuss some side effects of antidepressants. Right. So first we will discuss about SSRI, selective serotonin reuptake inhibitors, which are 5-HT spikers. They increase the 5-HT component. Now, if you ask me 5-HT2, right? Now, if you ask me about 5-HT2, which acts on the brain, the most common side effect of this 5-HT2 receptors activation is anxiety, insomnia, and vivid dreams. Right. Now, what are the drugs that are acted upon 5-HT2? What are the drugs that are acted upon 5-HT2? We just give benzodiazepines. For 1 month for patient on SSRI. Remember? So we will talk about these considerations later. But first of all, we will discuss about all the side effects caused by these receptors 5-HT2. Now 5-HT2, if acting on spinal cord, they cause erectile dysfunction. 5-HT2 drugs, if acting on spinal cord, leads to erectile dysfunction and also anorgasmia, which is delayed ejaculation. Now these are the side effects of 5-HT2 activators in spinal cord. Now if you ask me what about 5-HT3 activators, 5-HT3 activators, right, causes nausea and vomiting. Now what about 5-HT4 activators, causes loose stools, right. So these are some of the SSRI, selective serotonin reuptake inhibitors, receptors, their action and their side effects. Now if you come to the considerations, what is the first consideration? Benzodiazepines are always given for 1 month for a patient on SSRI, selective serotonin reuptake inhibitors. Now SSRI can be used in premature ejaculation. Why? Because SSRI causes erectile dysfunction when these drugs which act on 5-HT2 receptors present in spinal cord, they cause erectile dysfunction, or they call delayed ejaculation, they cause delayed ejaculation as the side effect. So these drugs can be used for premature ejaculation. Previously we have seen the side effect can be utilized as a therapeutic functionality. So these drugs can be used for premature ejaculation. If you ask me which drug, it is dapagliflozin. It is dapagliflozin, right. Now the erectile dysfunction, which is caused a side effect due to 5-HT2 receptors which are activated due to the 5-HT2 drugs on the spinal cord, this is the delayed side effect. It's not an instantaneous one, it's a delayed side effect. But the most common side effect due to 5-HT or SSRIs is vomiting. Most common side effect is nausea. Okay, most common side effect is nausea, right. Now we will discuss about SNRI, right. So we will discuss something about tricyclic antidepressants. So what they do is they inhibit the muscarinic receptors, leading to constipation, dry mouth, xerostomia, dry mouth, mydriasis, and one more important complications that tricyclic antidepressants may cause, that is, what is that? Can anyone? Urine retention. Why? Because the muscarinic action is being suppressed, it's blocked. So muscarinic M receptors block. Now what are some other active actions? It blocks 5-HT receptors, leading to obesity. Also block H1 receptors, leads to sedation. H1 blockers leads to sedation. Alpha 1 blockers leads to postural hypotension. What are the considerations? As they are muscarinic blockers, avoid their use in glaucoma, BPH. Then you can also see that TCA toxicity, tricyclic antidepressants toxicity, high risk of mortality in TCA toxicity is due to arrhythmias. High risk of mortality in TCA toxicity is due to arrhythmias. Okay. Now, what is the drug of choice for toxicity of TCA? TCA types toxicity, it is bicarbonate. It is bicarbonate. Okay. Right. Now, one more drug, some more drugs we will discuss. Mirtazapine, right? It causes sedation and obesity. It is a noradrenergic and specific serotonin antagonist. It is, remember, serotonin agonist. Remember, this statement is important. Serotonin agonist and noradrenergic and specific serotonin agonist. Now, trazodone. What do the trazodone cause? Trazodone causes something called priapism. Bupropion. Can you tell me one of the route of administration of bupropion? It's sublingual. Bupropion is used for seizures and maximum anxiety. Anti-anxiety drug. Seizures and anxiety. Right? Now, MAO inhibitors. Right? They cause, bupropion cause seizures and anxiety. Trazodone causes priapism. Mirtazapine causes sedation and obesity. And MAO inhibitors causes cheese reaction. Very important MCQ. MAO inhibitors causes cheese reaction and also serotonin syndrome. Very important side effect of MAO inhibitors. So, these MAO inhibitors are not actually used anymore. They were stopped by most of the clinicians. Now, we will discuss some of the side effects of antipsychotics. These all side effects you understand, I think, right? Okay. So, we will discuss some of the side effects of antipsychotics. Okay. Just 1 minute. I will come back. 1 minute, please. So, these all side effects, I think you read. You all are very much well versed with these side effects, right? Please study these side effects twice and thrice. Why? Because most of the times you get these side effects as a question, MCQ. That's for sure. Most of the times you get these side effects as MCQs that's for sure. So always be prepared with these side effects. You just revise. That's the only key point to revise these things. You just revise these side effects, don't leave them. Okay, so we'll discuss some of the side effects of psychotics right now. I'll just wait just one minute. Wait. Right, okay, so we'll start this one. We'll start this, so we'll finish it as fast as we can, right? I think the classes are getting a little bit delayed, right? Most of the students, they are complaining, sir, the class is getting delayed, sir. No, see, I am going slowly, that's it, because each and every student should follow it. Okay, so what are some of the side effects of antipsychotics, right? So we'll discuss the first one. Wait, yeah, for example, if there is D2 receptor blockade, right? If there is D2 receptor blockade, I think here the writing is not good. Wait, just hold it down. Yes, if there is a D2 receptor blockade, so what all things you will observe? If there is a D2 receptor blockage, you will see some extrapyramidal symptoms as well. You will see hyperprolactinemia. Okay, so it is maximum, these side effects are maximum with risperidone, right? Side effects are maximum with risperidone and minimum with clozapine. So clozapine is a safe drug. So if there is D2 receptor blockade, you see extrapyramidal symptoms and hyperprolactinemia as the side effects. These side effects are maximum with risperidone and side effects are minimum with clozapine. So remember this statement. This is very, very, very important. Now, if you ask me which psychotics has zero of these side effects, it is pimavanserin. Remember, it is pimavanserin, right? It is pure 5-HT2H1 inhibitor. Okay, now if out of D2 receptors, if there is other receptors blockade, what are the side effects that may occur? If there is other receptors blockade, what side effects may occur? Simple, there will be constipation, dry mouth, that is xerostomia, then it is mydriasis, urine retention, and I think in a simple word, these all symptoms occur due to blockage of which receptor? Simple, muscarinic receptor. So if there is a muscarinic blockade which is caused due to antipsychotics, then what are the complications you see? Side effects: constipation, xerostomia, mydriasis, urine retention, and obviously if there is M blockade, you should obviously avoid in glaucoma. So antipsychotics of the drugs which act on other receptors, antipsychotics which act on other receptors, if for example if it is an M receptor, obviously that drug should be avoided in glaucoma as well as BPH. So these drugs should be avoided in benign prostatic hypertrophy. Now if these drugs block H1 receptor, it leads to sedation. Now if these drugs block the H1 and 5H1, H1 as well as 5H1, it causes obesity. Now if they block alpha 1, they cause postural hypotension. Now these drugs are also called metabolic side effects like dyslipidemia, hyperglycemia, right? So these side effects are maximum seen with clozapine. Here clozapine's action on D2 receptor causing side effects is minimum, but clozapine action on other receptors causing side effects is maximum, more than olanzapine. Clozapine more than olanzapine. And here minimum side effects on other receptors due to action on other receptors is seen with risperidone. See the funny thing, it's funny, right? Risperidone. Now you may ask me, sir, here which drug will not show any or zero side effects, that is weight neutral? It is aripiprazole. Aripiprazole or cariprazole. The cariprazole is a partial agonist at D2, and 5-HT1A is actually 5-HT1A receptor is being acted by ziprasidone. Remember, ziprasidone. Okay, now we finished up to here. Now if you ask me what are some extrapyramidal symptoms that are caused by some drugs and what are the drug of choice for the treatment, right? Now first one is akathisia, most common, restlessness. Most common thing that you see that is in akathisia is restlessness. What is the drug of choice? Beta blockers. Simple. Now add on, if you want some other drug with this, then you go on with benzodiazepines as an add-on drug. Now you also see acute dystonia as EPS sometime, which is the earliest EPS symptom you see. What is acute dystonia? Abnormal posturing, facial grimacing, right? Then what is the drug of choice? It will be anticholinergics. Anticholinergics. For example, if you ask someone the drug is benjexol. Benjexol is the anticholinergic drug which is used for drug of choice as acute dystonia. Benjexol or also trihexyphenidyl. Remember these drugs, right? Now sometimes you may also see Parkinsonism as EPS, extrapyramidal symptom, that is tremors and bradykinesia are observed, right? And this Parkinsonism is also seen with metoclopramide. Guys, this is a repeated question. I don't know how many times, something like 4 times it came in the Neet PG as well as Inicet. Metoclopramide causes Parkinson's. No, sorry. Metoclopramide causes dystonia. I think it should be here. Acute dystonia like state. Acute dystonia like state. Metoclopramide causes. Why? Due to D2 block. As metoclopramide causes D2 block, it causes side effect like acute dystonia. Okay, so this one I think you should erase it. Erase it, right? Dystonia, very important. Why metoclopramide shows dystonia, acute dystonia side effect? Due to D2 blockade. Okay, now for Parkinsonism side effect, what drugs you will use? Simple, antihistaminics, that is promethazine, right? Now one more important side effect is neuroleptic malignant syndrome. Right? It is the most lethal syndrome. Now if you ask me the drug of choice, it is dantrolene, right? So what features you see in neuroleptic malignant syndrome? You see muscle rigidity, hyperthermia, right? Autonomic instability, sweating, tachycardia, tachypnea, and very labile BP, means the BP fluctuates very frequently. Now why this neuroleptic malignant syndrome occur? Due to D2 blockade, right? Due to D2 blockade. Now if you ask you the drug of choice for neuroleptic malignant syndrome, it will be dantrolene sodium. But if the examiner asks most specific, not drug of choice, most specific, then it will be bromocriptine. Remember, most specific drug, if it is asked, it is bromocriptine, right? Also dantrolene is the drug of choice for malignant hyperthermia. Now you see another component, another side effect, that is tardive dyskinesia. It is the most delayed side effect. Right? Now what is the drug given for this tardive dyskinesia? You give VMAT2 inhibitors. What is the drug? Valbenazine and deutetrabenazine. Okay. Now one more side effect you see is facial dyskinesia. Guys, don't get confused. These all are extrapyramidal symptom side effects which we observe with these psychotic drugs, right? These psychotic drugs, because these antipsychotic drugs causes a heck lot of serious complications. So for these complications, what treatment should be given without stopping the so-called antipsychotic? That is what our main criteria is. So we are discussing all the extrapyramidal symptoms or side effects which are caused due to antipsychotics, and their treatments or drug of choices we are discussing. So don't get confused, okay? So facial dyskinesia means what all will be present? Tongue protrusion, lip smacking, limb dyskinesia, piano finger movements. See, you just see tongue protrusion and lip smacking. And another side effect which you see is limb dyskinesia. You also see limb dyskinesia. In limb dyskinesia, what you will observe? In limb dyskinesia, you observe piano finger movements, piano like finger movements, and foot tapping. But all along, tardive dyskinesia, what is the treatment of choice? That is VMAT2 inhibitors. Those are valbenazine and deutetrabenazine, right? So why this dyskinesia occur? Why this tardive dyskinesia occur? It is due to upregulation of D2 receptor. It is due to upregulation of D2 receptor. I think it is okay up to here. Now we will discuss something about lithium, right? The main thing about lithium is its side effects. Its side effects is the most examiner's favorite. You remember with the mnemonic hot head, right? H for hypothyroidism. O for obesity. T for tremor. At normal concentration, it's fine, but at toxic concentration, it is a coarse tremors. At normal concentration, it causes fine tremors, but at toxic concentration, it causes coarse tremors. Okay. H for hypercalcemia. E for Epstein's anomaly. This is the MCQ. Lithium causes Epstein's anomaly. Okay. So that is, and it's also the reason for contraindication in first trimester of pregnancy. Okay. Okay. Then A for acne. A for acne. D for diabetes insipidus. Diabetes insipidus. The patient has excess of thirst. The patient who is on lithium complains of thirst. So what is the drug of choice for this? You give amiloride. For diabetes insipidus, which is seen in the lithium treated patient, the excess thirst which it is occurring, the diabetes insipidus condition, we give the drug amiloride. Okay, remember. Now, what are the food and drug interactions that we most commonly see? Food and drug interactions that we most commonly see. Okay. Now, lithium and sodium are actually similar in structure. See, listen this concept, it is very important. Previously you got a MCQ 2 years back. Lithium and sodium are actually similar in structure. Structurally they look similar. Now, sodium deficiency or loss, if there is a sodium deficiency or loss, right, due to diuretics, right, in diuretics, which diuretics cause sodium loss or deficiency? Thiazides. Write down this statement here in a bracket. You write it down. Thiazides cause more sodium loss than potassium sparing than loop diuretics. It is the order. Thiazides cause more sodium deficiency or loss greater than potassium sparing greater than loop diuretics. So what happened? Sodium deficiency or loss due to diuretics, right? Diarrhea, vomiting and fasting. Due to diuresis, diarrhea, vomiting and fasting, right? Vomiting and fasting, right? This may lead to, these conditions may lead to lithium retention and toxicity. Lithium retention and toxicity. You got this? You got it or not? So sodium deficiency or loss due to diuretics, right? Diarrhea or vomiting and fasting can lead to lithium retention and toxicity. So always be cautious when giving lithium along with some sodium medication, sodium related medication, right? So these may cause lithium retention and toxicity. You got it? So what we will do? We will do therapeutic drug monitoring. So how we will do it? We will take blood sample 12 hours after last dose. 12 hours after last dose. Now, if the report came like, see this, very important. If the report came like, if the value is from 0.6 to 1 milliequivalents per liter, it is denoted as therapeutic range for prophylaxis of mania. So 0.6 to 1 milliequivalents per liter concentration of lithium is the therapeutic range for prophylaxis of mania. But if the concentration is more, something like 1.0 to 1.5 milliequivalents per liter, then it is the therapeutic range for acute mania. This is the therapeutic range that should be maintained in acute mania. 0.6 to 1 is the therapeutic range maintained in mania. If the range of concentration, if the concentration is more than 1.5, then it indicates it is toxicity of lithium. But if the concentration is more than 4, then it is an indication for dialysis. In this way, you should monitor the lithium drug. Now we will discuss some side effects and withdrawal symptoms of opioids. Some side effects and withdrawal symptoms of opioids. We'll discuss some side effects and withdrawal symptoms of opioids. Here we'll write the side effects, and here we'll write the withdrawal. Right. Side effects due to what? Side effects due to mu receptors. Listen this carefully. The side effects and withdrawal symptoms of opioids are very important and potential MCQ. Okay. Now the side effects can be denoted with a mnemonic muscarinic. Causes meiosis, urine retention, sedation, constipation and convulsion, analgesia, respiratory depression, increased muscle rigidity, no bile flow or no contraction of sphincter of Oddi. That's why opioids are contraindicated in bile patients with bile colic, because it causes no bile flow, or it just causes no contraction of sphincter of Oddi. And final side effect is euphoria. You got it or not? Meiosis, urinary retention, then sedation, constipation, convulsion, next analgesia, respiratory depression, then increased muscle rigidity and no bile flow or no contraction of sphincter of Oddi. That's why opioids are contraindicated in bile colic. And finally euphoria. But there is a recent addition, there is a recent note, like opioids are no longer contraindicated in management of pain in bile colic, pain due to bile colic. Yes, they can be indicated. Okay. Now what are the withdrawal symptoms of opioids? Symptoms due to withdrawal are just opposite due to mu receptor stimulation. As simple as like. Don't make anything complicated. Withdrawal symptoms are simply opposite to this mnemonic. Means meiosis means mydriasis. Urine retention means urine flow, heavy urine flow. That is, what is that? Can anyone tell? Urinary incontinence. Constipation means you will get loose stools, diarrhea. Right? So that is opposite of mu receptor stimulation. Simply the withdrawal symptoms can be just said like these symptoms are just opposite of mu receptor stimulation. You just understand like that's it. Those are the withdrawal symptoms. Nothing much. No need to discuss as brief as like. Okay. With this we finished opioids. Next one is antimicrobials. Antimicrobials. Okay. I think antimicrobials, very important chapter, very important topic. We'll finish here, or we will just stop it up to here. I am just thinking whether we should finish or we can stop it here, right? Antimicrobials is a very, very long topic, trust me, very long topic. A very long topic, right? Okay, no problem. Now before antimicrobials, I just want to tell one thing. One of the student asked me, sir, you did not tell about order of kinetics. Yes, sure, I will tell you. One of the student asked me, sir, just tell us about zero order versus first order kinetics. One of the student asked first order kinetics. Guys, this is very simple. It's no need to bang your heads. Okay, it's a very simple concept. See, what happens in zero order is, I'll write with red pen. See, constant amount of drug is eliminated per unit of time. Here, constant proportion of drug is eliminated per unit of time. Now I will explain you briefly. For example, there is 50 milligram drug in your body. For example, if it is in case of zero order, for every see, it is for example only, right? Don't take it seriously. It is just an example. After every 1 hour, 10 milligrams of drug will get eliminated for every 1 hour. Okay, so 40 is left. After 1 hour, another 10 milligrams is eliminated, 30 left, right? After 1 hour, another 10 milligrams is eliminated, 20 is left. So here constant amount of drug is being eliminated irrespective of the end product. Constant amount of drug. Now if you come to first order kinetics, what happen is, you take a 50 milligram of drug, constant proportion means for every 1 hour half of the drug will be eliminated, for every 1 hour 1/4 of the drug will, so there will be a proportional division. For example, this drug, for every 1 hour half of the drug will be eliminated. So it is a first order kinetics following drug. This drug follows first order kinetics, means after 1 hour this drug will become the 25 mg concentration. After 1 hour this drug will become 12.5 mg. After 1 hour this drug will become 11.25 mg. So here constant proportion of drug is being eliminated. I think you understood this, right? For example, if you want to tell me in another way, I will tell you. Wait, see, actually it's very good that student asked me to tell about kinetics. I'm very happy for him, because it's very important topic. For example, you have 10 chocolates with you, right? Your brother asked you, brother, you give me 1 chocolate every day. you give me one chocolate every day. For example, today you have 10 chocolates. Tomorrow it will become 9, because tomorrow you should give one chocolate to him. Day after tomorrow it becomes 8. Day after tomorrow it becomes 7. So every day you are giving one chocolate to your little brother. You are giving one chocolate to your little brother. So every day one chocolate will be decreasing from your total number of chocolates. But your little brother is a cunning boy, so he did not ask like that. So you have 10 chocolates, right? So your little brother asked like, brother, every day you give half of the total chocolates you have on that day. For example, today you have 10, so half of 10 means 5 chocolates, so you give 5 chocolates today. For tomorrow you will be left with 5, so half of that 5 means you should give 2.5, so say 2 chocolates like. So day after tomorrow morning you will be left with 2.5. Half of that means how much? 1.25 chocolates. So here constant proportion, half. But the scenario in zero order kinetics, it is constant amount. Okay, so constant amount of drug is eliminated in zero order, constant proportion is being eliminated in first order kinetics. Okay, now what are the actual important things that you should learn here, right? In both zero order and first order, the most important things that you should keep in mind is important factors. Clearance. How will be the clearance in zero order? Here constant amount is being eliminated, so the clearance time, the clearance of the drug will decrease, but the half-life of the drug will increase, right? What is in case of first order kinetics? The clearance will be constant. Clearance will be constant. Why? Here constant proportion, there will not be any decrease or increase. Here there will be constant proportion. Okay, here there will be constant proportion. Okay, and the half-life also remains constant. The plasma concentration in case of zero order, the plasma concentration is maintained disproportionately, but in case of first order it is maintained proportionately. Now what are the examples of zero order kinetics? What are the examples that follow zero order kinetics? Alcohol, theophylline, tolbutamide, phenytoin, heparin, methanol, warfarin. While most of the drugs follow first order kinetics. Okay, I think it's okay up to there. It's okay or not? Or any topics you want, just say now only. It's okay up to there or not? Tell me. Okay. So I think it is okay that we start with antimicrobials. We start today or we start in the next class? It's your wish. If you ask me to start today, I will start today. Or we can also do one more thing. We can keep antimicrobials and we can start other chapters today. It's your wish. Right, whatever it is, you just decide. I will come in 5 minutes. Decide which topic you want. I will come in 5 minutes. Okay guys, welcome. So we'll start with antimicrobials itself. Okay, most of the students are asking antimicrobials, so we'll start with antimicrobials. Okay, just clear it off. So we'll start with antimicrobials. Sorry if I hum any songs. Don't feel otherwise. I just love to hum some songs. Okay. Antimicrobials. So just leave it off. Leave the heading, right? So antimicrobials. First of all, we will just define which classes of drugs, which drug classes are cell wall synthesis inhibitors or otherwise bactericidal drugs. Number one is beta lactams. Guys, very important, this chapter is, just pay attention. Beta lactams. Beta lactams, what are they? What are the beta lactams? Can anyone tell? Penicillins, cephalosporins, carbapenems, monobactams, right? So beta lactams, vancomycin, bacitracin. With beta lactams, what are other drugs which are bactericidal? Vancomycin, bacitracin, then comes cyclosporin, then comes phosphomycin. Bacitracin, cyclosporin. Okay, so these are the bactericidal drugs. Now, which class of drugs causes protein synthesis inhibitors? Which are also called bacteriostatic. Okay, number one is tetracyclines. Guys, remember this classification very much because you will get a potential MCQ from this. Okay, I'll write this completely so that you can understand. Carbapenems, monobactams. So these all drugs are bactericidal. Now these drugs which I am writing right now, they are bacteriostatic. What is the mechanism of action of tetracyclines? They block A site on mRNA. They block A site on mRNA. Now, what are the other classes which are bacteriostatic? Aminoglycosides. And one more thing, remember, these aminoglycosides, they are also bactericidal also. They are bactericidal as well as bacteriostatic also. Okay. Now, what is the mechanism of action? What is their mechanism of action? What they do is they cause misreading of mRNA. Right? But what is the mechanism of resistance for aminoglycosides? What is the mechanism of resistance, if you ask me? That is enzymatic inactivation. Except amikacin. Remember. Except amikacin. So that is the reason why these are not effective against anaerobes and typhoid. Now some other classes which are bacteriostatic, that is macrolides. Macrolides means erythromycin, roxithromycin, clarithromycin. These are linezolid. Linezolid is a higher end antibiotic. Remember, linezolid. Next one is streptogramins. Streptogramins. Next one is clindamycin. Clindamycin. Okay. So this table is very important. It can be a potential MCQ in Inicet or Neet PG also. Okay. Chalo, let's go to the next thing. What are the drugs acting on cell membrane? Drugs act on cell membrane. Those are bactericidal drugs. Bactericidal drugs. They can be notified as bactericidal drugs. First one is daptomycin. Daptomycin. It's a lipopeptide. What is the mechanism of action of daptomycin? Depolarization of bacterial cell membrane. It simply depolarizes the bacterial cell membrane. So what it happens if depolarization, if the bacterial cell membrane depolarizes, what happens? It simply leads to efflux of potassium. The bacteria dies. Simple. Now one more class of drug is polymyxins, which act on bacterial cell membrane. That is colistin is example. Colistin. Now some antifolate drugs. Drugs which act like antifolates. Those are sulfonamides. These are statics, bacteriostatic. Cotrimoxazole. These are bactericidal. Okay. Now what is the mechanism of action? They inhibit DNA gyrase. Right. Now fluoroquinolones. Fluoroquinolones belong to which category? They are bactericidal drugs. First one is ciprofloxacin, very important fluoroquinolone. Second one is ofloxacin. Third one is respiratory quinolones. Which are used for the treatment of pneumonia. Okay. Now some other are gemifloxacin. Then levofloxacin. Right, just 1 minute. Levofloxacin, then moxifloxacin. See, this moxifloxacin has the maximum T half as well. It has the maximum T half, remember, as well. It also causes QT prolongation. Remember this. It has the maximum T half and also causes QT prolongation. Okay. It can also cause seizure potential. It can also cause seizures. It is most commonly excreted through liver. It is actually excreted through liver, that is hepatic excretion. So never used in UTI. So it is never used in UTI. Okay. Next, cell wall synthesis inhibitors. Remember, cell wall synthesis inhibitors. Their site of action, I will just show it with a diagram in the next class, right? I will show it with a diagram in the next class. Next class. Till then I will just remember like this. I will show it with the diagram in the next class. Don't think otherwise. Now we will get on to antibiotics uses. Some antibiotics and their uses, regular uses, right? I think it's better we'll stop here, right? Because I think the time is almost there. So we'll stop here. Okay guys, so I'm happy to start antimicrobials finally. So we'll finish it in the next class. We'll finish antimicrobials. Then what are the drugs? Antimicrobials, anti-cancer, right? And we will finish 3 more chapters in this drug. In the next 2-3 classes we will finish pharmacology. Okay, till then, bye, have a good day, your wise doctor. Thank you very much.